moderator of the panel, Dr. Romero, fellow panel members, distinguished ladies and gentlemen, good morning. As announced, my name is Ruben Martoredjo. I'm from Surinam. I will be presenting today the subject of social security systems in the Guiana Shield region. The Guiana Shield's role as a critical ecological zone with abundance of natural resources highlights the need for balanced strategies that integrate conservation, social development, and sustainable economic growth. In my view, social development is underserved academically. Hence, the reason why I will address this subject this morning. The Guyana Shield is home to several indigenous and tribal peoples who depend on its ecosystems for their livelihood, also their cultural practices and survival. The preservation of their rights and traditional knowledge is vital for sustainable management of the region. Also, the region has untapped opportunities for education, health services, and poverty reduction, which are essential for reducing inequality among the indigenous and rural populations. As being part of Latin American and Caribbean region, the Guyana Shield region has a situation in which poverty affects approximately 24.7% of the population in 2024, according to the World Bank. Although post-pandemic economic recovery has improved labor market conditions, we still see that disparities persist in this region. Poor households often face limited job quality and income growth opportunities. We also have the situation in Venezuela, where extreme poverty rate remains critically high due to a prolonged economic crisis, with some estimates placing extreme poverty at over 75% in recent years. Income inequality, measured by Gini coefficient, is a persistent issue in the region. In Suriname and Guyana, being part of the Guyana Shield region, economic dependence on extractive industries exacerbate wealth disparities, leaving indigenous and rural population disproportionately vulnerable. Social protection system seems to vary significantly in the Guyana Shield region. In French Guiana, as part of France, residents benefit from a robust European-style welfare system, including healthcare, unemployment benefits, and pensions. In contrast, countries like Guyana, Suriname struggle with underfunded and poorly implemented social security systems, leading to coverage gaps for informal workers and rural communities. Limited access to quality education and healthcare exacerbate inequality, particularly in rural and indigenous areas of Guyana and Suriname. French Guyana, which has a better system, still faces challenges in addressing disparities among migrant populations, for instance. Across the region, women often experience lower quality jobs, wage gaps, and limited access to social protection. This disparity is pronounced in agriculture and informal sectors where women are predominantly but poorly represented in policy discussions. Zooming into the social security system in the different territories and starting by Guyana, we will see that in Guyana, for instance, the social security system is managed by the National Insurance Scheme, the NIS, which falls under the Ministry of Finance. The system provides benefits for old age, disability, survivor pensions, sickness, and maternity benefits. The system also faced challenges, which include administrative capacity, limited funding, and informal economy. Recent efforts focus on expanding coverage to underserved population, especially in rural and indigenous areas. We've seen also efforts made by the officials in Guyana to improve the system. In Suriname, the social protection framework is governed by the Ministry of Social Affairs and Public Housing. And it includes old age pension, general health insurance, disability support, and welfare programs. We face a limited reach to remote areas, including coverage to indigenous and maroon communities. We're also facing economic constraints and inflation, which affects the benefit levels um, and also the real value of the social benefits. Suriname has recently introduced the digital platforms to streamline access and improve data management for social security. French Guiana, as an overseas department of France, benefits from the comprehensive French social security system. It includes universal health care, family allowances, unemployment benefits, and pensions. Among the challenges, French Guiana face issues in reaching remote areas, and they are facing also high levels of poverty, especially in certain segments of society, and healthcare access disparities. Their recent initiatives include focusing on improving outreach and healthcare provisions in indigenous communities. Now we'll zoom into the larger countries, starting with Venezuela. Venezuela's system is centralized and historically based on principle of universal coverage and solidarity. It operates under the framework of the Ley Orgánica del Sistema de Seguridad Social, LOSS, and includes health insurance. And in fact, public health care is theoretically free for all citizens in Venezuela. But in practice, access is limited due to resource constraint. In regard to pension, the pension scheme is managed by the Instituto Venezolano de los Seguros Sociales. And pensions are available to workers who have contributed for at least 750 weeks. But economic instability has eroded the real value of the pensions. When it comes to unemployment and disability benefits, the coverage is limited and the real value of the benefits has also declined sharply. Due to the country's prolonged economic and political dynamics, the system faces severe challenges, including underfunding, inflationary pressures, and inefficiencies. Colombia. Colombia has a mixed model combining public and private elements established under the 1993 Law 100. It aims to provide comprehensive coverage in health, pension, and employment-related benefits, but inequality in access persists in Colombia. Their universal health coverage operates under a two-tier system where you have a contributory regime for formal workers and a subsidized regime for vulnerable population. Also, the pension has two regimes. One is the pay as you go, which is for the public, and the individual capitalization scheme, which is more for private insurances. The pension coverage is low, and particularly in rural areas and informal sectors, the coverage is very low. Unemployment insurance is limited and often inadequate for informal workers. But Colombia has a program which is called Familias in Action, which provide conditional cash transfer to reduce poverty. Among the challenges they face are the high informality in labor markets, which limits the contribution to the system, and regional disparities in access and quality of the services. And last, Brazil. Brazil has one of the most comprehensive system in Latin America, which is established under the 1988 Federal Constitution. It combines contributory and non-contributory schemes to ensure social protection for the majority of its population. Brazil has the unified health system, which offers free and universal health care. Despite their wide range coverage, disparity, inequality, and access still persist under the health insurance scheme. Brazil has also a robust pension system, which includes the general regime for Social Security and special regimes for public servants. Recent information informs that the retirement age has been increased to address the fiscal sustainability challenges that Brazil is facing. In regard to unemployment benefits, unemployment insurance and maternity leave are well established in Brazil. Brazil also has the very renowned Bolsa Familia program, which provides conditional cash transfer to reduce poverty and inequality. Among the challenges, Brazil faced a high public spending on pension in relation to their GDP. Also, informal labor limits coverage and increased pressures on non-contributory schemes of Brazil. All right, if we compare the different security system, we will notice that there is a significant diversity in the social security system within the Guiana Shield region. Summarizing, when we look at the coverage and equity, French Guiana have a comprehensive system when it comes to coverage and equity due to their integration with the system of France. Brazil and Colombia, they have an advanced system but inequitable in the rural areas. Suriname and Guyana has limited benefits and major gaps in rural areas. Venezuela, their system eroded due to the crisis, to their economic and political crisis. When it comes to accessibility, I think all territories face rural and indigenous population gaps in regard to the coverage on rural and indigenous population. In regard to challenges, we can summarize that fiscal constraints and underfunding are present in Suriname and Guyana, regional inequalities in Brazil and Colombia, systematic collapse in Venezuela. In regard to opportunities, regional cooperation through ACTO and similar initiatives are potential opportunities. There is opportunity for targeted reform to address gaps in coverage and access, and also leveraging international framework for policy improvement. And as last opportunity, I would list the expanding digital infrastructure for data-driven social policy. But across the region, we have noticed that accessibility gaps for marginalized communities are still present and persistent. From the IR perspective, I would recommend the following joint collaboration initiatives. First is the regional integration on social protection policies. The region could develop a regional framework for social security that harmonizes policies and allowing movability of benefits across borders, particularly for mobile population like indigenous communities and migrant workers. The region could also establish a Guyana Shield social protection knowledge network to share best practices such as the Bolsa Familia and the French Guyana outreach strategies for remote areas. Jointly, a fund and implementation program could be developed and established, tailored to the unique needs of, for instance, the indigenous and tribal communities, focusing on healthcare access, old age pensions, and social safety nets. Also, the region could develop regional strategies to extend social security to informal workers, leveraging Colombia's subsidized health regime and Brazil's non-contributory cash transfers as models. The region could also invest in a regional digital platform to streamline social security registration and improve data management. Acto's platform and Suriname recent digital initiative could serve as a starting point in this case. The region could also enhance collaboration on healthcare delivery for remote and border areas, allowing residents to access health facilities in neighboring countries as needed. We see an example in French Guiana where Surinamese people living in the border could access and health services in French Guiana for free. The region could also create a Guyana Shield Social Security Fund, the GSSF, supported by regional governments and international donors to address shared challenges like migration, indigenous welfare, and poverty alleviation. And finally, the region could also establish a regional monitoring framework to assess social protection system effectiveness and sustainability, encouraging accountability and evidence-based improvements. These recommendations are not all new. We have seen examples like the one that was proposed or actually implemented by UNASUR. UNASUR is known to have sought to enhance regional integration in social development through specific programs and initiatives. UNASUR's social agenda aims to tackle inequalities by creating integrated regional policies in health, education, infrastructure, and supporting vulnerable groups and promoting sustainable development. Currently, ACTO, the Amazon Cooperation Treaty Organization, through the Amazon Regional Observatory, the ARO, a platform for integrating data and fostering regional collaboration on critical issues like social development, environmental conservation, and indigenous rights, support monitoring of key metrics such as health, poverty, and education. And in conclusion, um, the region has a diverse social security system reflecting political and economic context of the region itself. And challenges include remote access, funding, and indigenous support. In regard to improvement, efforts should be made to address systematic issues in governance and economic inequality. Also, leverage should be on unique environmental and cultural assets of the region. Key area of focus can be on enhancing accessibility, investment in infrastructure, digital access, and mobile outreach. Focus will also be given to indigenous and rural inclusion. Programs should be tailored considering cultural and geographical factors, and collaboration with regional and international bodies should be considered. We should leverage support from, for instance, ACTO, CDB, CAF, ILO, and other international and multilateral organizations. In regard to the prospects, the region should consider strengthening regional cooperation and partnership on social security, address disparities with targeted reforms and initiatives, and enhance social security integration through, for instance, the initiative of ACTO and other similar frameworks. I want to thank you for your attention, and regretfully, I cannot entertain any question, but if you still have burning question, you may extend that by email or through WhatsApp. Thank you, and over to you, moderator.